Well, we start off today with the federal government shutdown. It sits on day 30. The U.S. Senate is not planning on a vote of any spending bill. In fact, at last check, senators aren't expected to gavel back into session until Monday afternoon. Meanwhile, there are some signs on Wednesday, of potential progress for the first time in weeks. This is based on some senators, including GOP leader John Thurman, expressing some caution optimism about bipartisan talks. The big reason Saturday's deadline is upon us, the freeze of the benefits under the Supplemental Nutrition Assistance Program, or SNAP, which helps 42 million Americans buy food. It is that hope for bipartisanship, which is one group's hope, can be done before there's more damage to the federal economy and bureaucracy. So one group is calling for unity. The National Active and Retired Federal Employment Association. With us now is the Vice President for Policy and Programs, John Hatton. Welcome to the show.
Thank you for having me.
All right, your group has been clear that this shutdown is taking quite a toll on both the active and the retired federal workers. Give some sense of the scope of what the impact is right now.
Well, from the federal employment side, you're having missed paychecks. So you already had 1.5 or 1.25 missed paychecks. You're going to have another one next Friday. You have military potentially missing their first paycheck November 1st. The administration may figure out a way to do that. You have larger economic impacts that you've mentioned, like people getting food assistance and food stamps, potentially going hungry, which would be really critical. That's November 1st. So the longer the shutdown goes on, the more economic impact it has negatively, the more it's forcing people to go without critical paychecks that they need to buy their groceries, to pay their rent. And it starts to get to be disruptive on the government operations that are considered essential as people start calling in sick. People will only work for so long without any pay.
Yeah. When you talk to your members, what are they talking about the most? Is it about like rent, paying their housing bills, or what is it they're talking about the most?
Yeah, they're certainly concerned about that, about the ability to pay and when they're going to get their next paycheck. But I think there's also a larger question here on the shutdown is who's kind of going to be in charge of the spending. And so we've been pushing for this bipartisan agreement that goes through Congress, that allows Congress to make the decisions regarding what the government does.
That bipartisan negotiation that you're talking about now, from your perspective, what stands in the way for it to come together?
Well, I think there's two things. On the House Republican side, they have passed what they consider a clean CR. And we've argued it's not clean because the Trump administration has unilaterally impounded and rescinded funds. So things you've seen with, CDC getting layoffs in Atlanta weren't really done with the buy-in of Congress. So it's some type of bipartisan deal that decides to have a balance and have Congress have a buy-in in some of these larger decisions about what the government does. On the other hand, on the Democratic side, we'd like to see them push a little bit more to focus on the government funding issues and at least moderate their demands demands to become for a vote on the Affordable Care Act premiums, which, people have their own views on that, may be very critical for people to lose health coverage, understand their position. But if you're holding up all government funding for that and you can't get bipartisan agreement on it, at some point you need to kind of come to the table.
Yeah. John, we said earlier that there was some rumblings that both sides could be coming together. Are you buying that at all?
I think maybe. We're really coming at a turning point here. November 1st has a lot of critical dates, whether it's military pay, whether it's the SNAP benefits. It's the beginning of open season for the Affordable Care Act exchange plans. So people are going to start to see when they can go sign up for plans that have higher costs or not. So it should at least be a pivot point to kind of consider where do we go from here. Yeah. Next Friday is another set of missed paychecks for federal employees. So my hope is in the next week we see some progress, but I don't know. So it's just rumblings, I think, at this point, but it's better than what we've seen over the past month.
Yeah, some signs right there. So if they don't reach an agreement, how is your group helping to help meet those needs?
Any way we can, to the extent we can provide assistance. Certainly connecting people with resources. We have a whole shutdown resource page. If you're a furloughed employee, you may be able to apply for unemployment insurance. It's going to be devastating in terms of the number of people who need help. People going without potential food assistance would probably be the highest level. And then for our members, any way they can get there, and additional assistance, whether it's no interest loans or unemployment in these cases. So just trying to make sure they have the resources or taking advantage of the resources that are available to them.
Okay, I got 30 seconds left here. Do you believe that the bipartisanship can be restored in Washington, or has it gone too deep?
I think it can. I think you're seeing kind of talks ongoing. I think the Senate's probably the place where you see it first emerge. They're just the Senate rules require 60 votes for this, which is why you need a bipartisan deal. It's not because one party or the other has got to be right. It's because you don't get a bill passed through the Senate without eliminating the filibuster without 60 votes. And so I think you're starting to see some talk there. They've actually had a degree of bipartisanship in the larger funding bills that are not just a clean CR, quote unquote. So, they may start to just pass the full funding bills and not just extend last year's funding. So they're actually making decisions about what the government is doing. I think there's some hope for that because in the appropriations committees that control these government funding bills, they've had that bipartisanship.
All right, John Hatton, thanks so much for joining us today. Really appreciate it.